If you take on average India and you look at stroke, we would say there's probably 8 strokes happening per district per day. 40 to 60%, yeah. They're gonna have some kind of deficit that affects the rest of their life. When we don't get proper sleep, when we don't manage stress properly, when we don't eat food that's good for our body, these are the things that actually lead to disease, which eventually manifests as blockage in the blood vessel. In the heart, it's a heart attack. In the brain, it's a stroke. The goal of rehabilitation is to get a person back to as much as they can do independently. When a person can't do things the way they want to, they should seek rehabilitation. G Gaiter makes everybody's work easier. You can retrain normal function. If you retrain normal function, you're training the body the way it's supposed to work, so it's going to be usable longer. So what is rehabilitation without robotics? It's hard for everybody. The majority of people treating stroke are going to be neurologists who don't have access to this technology. When you have access, everything changes. Any amount of therapy, there's a limit you're going to accomplish. But when a person has a reason to improve, they show you just how good they are. Perfect practice makes perfect. Not just practice, perfect practice.
Perfect practice.
And perfect is going to be the normal walking pattern. So devices that help us mimic that help us get there. Most people are fascinated. They sit back and watch what's going on, what they're doing that person. Yeah, but then the other person is really interested. They're going through it. There's virtual reality. There's a screen showing them a walk on a beach. Well, it's kind of fun.
Hi, welcome to another episode of Voice of Genrobotics, a platform where we'll talk about transformative technologies that will help the society. To help us better understand about stroke and how to cure from it and how to win against it, we have a very eminent personality, Dr. Ravi Sankaran, the HOD of Department of Physical Medicine and Rehabilitation, Amrita Institute of Medical Sciences. Doctor, welcome to the show.
Thank you.
Yeah. So could you let us know a bit more about yourself to the audience?
I'm just your average guy, but I am the head of the Department of Physical Medicine and Rehabilitation at Amrita. I came to India in 2009 after my residency at Michigan State University. I've been waiting to get my hands on technology to help my patients because we've seen how much they can accomplish without these kinds of things. So I'm looking forward to today's talk.
Yes, we are all. Actually, yeah, that the point you emphasized is very relevant. Every year we observe the World Stroke Day with an ambition to spread more information and help more people to get better from stroke or any relevant situations arising from it. Speaking about strokes, there is a fact which I recently read in the news that one new stroke case is reported every 40 seconds in India. So that itself seems like a huge thing. And that literally means that many people are day by day affected by this sickness. So how do you think and why do you think this is happening? And why how the once if somebody has stroke, how they should take it forward?
So that's 2 questions in one go, which is fine. Just we'll start with the first one. Why is there so much more stroke? Essentially, we see as stroke as a manifestation as cardiovascular disease. Why is there more cardiovascular disease? Because of the rise of non-communicable disease. That is lifestyle-induced. So what makes those things rise? When we don't get proper sleep, when we don't manage stress properly, when we don't eat food that's good for our bodies, not stuff that tastes good, but stuff that's good for our bodies and for us as people, when we don't get enough physical activity. These are the things that actually lead to disease, which eventually manifests as blockage in the blood vessel. In the heart, it's a heart attack. In the brain, it's a stroke.
True.
So when a person doesn't have a good diet, they start getting obstructions in their blood vessels. If that obstruction happens in the heart, we call it a heart attack. If it happens in the brain, it's a stroke.
True. So once in the today's world, we have gone a long way in stroke, the curative part of stroke, I'll say, the surgeries and all. When the stroke comes, we immediately go to many hospitals are well equipped with the stroke surgical part. So once the stroke surgery is completed, what happens next?
This is really important. What happens, a couple different things. Once the treatment of the stroke is done, we have to treat the person. How do you treat the person? There's very good science that shows us the more you mobilize them early on, the sooner they're going to come out of the ICU, off the ventilator, have less infections, and eventually go home sooner. So that's one part of it.
Yeah.
So now from there, we get into two different situations.
Yeah.
You see, if you take on average India and you look at stroke, we would say there's probably 8 strokes happening per district per day.
8 strokes
Yeah.
per day,
Roughly.
per district.
Yeah.
Oh,
So of those, 2 of those people are probably going to expire. 2 of those will walk out perfectly fine and probably not have much problems, small strokes. The other people are going to live with deficits.
so approximately, sorry to interrupt,
Yeah.
approximately 50% are going to have the deficit.
40 to 60%, yeah. They're going to have some kind of deficit that affects the rest of their life. And this will affect everything they do. And they can't go back to life as it was before. So what makes a difference there? We're not talking prevention, we're not talking about treatment of a condition, we're talking about treatment of a person who now has a problem. And that is rehabilitation.
Okay. Yeah. So speaking about rehabilitation. So once, let us say we have a patient, that stroke curative part is done. Now we are going into rehabilitation. So what are the conditions that a patient, from a patient perspective, how do a patient know I will have to go to rehabilitation, or these are the conditions and there is the cure in rehabilitation? So could you shed some more light on what will happen, what the conditions will be, and how should they do the next steps?
The goal of rehabilitation is to get a person back to as much as they can do independently, considering the condition they have and the other conditions they might have, like a diabetes or a hypertension, those things. So a younger person who's had their first stroke may not have any other diseases. So they'd be much easier to rehabilitate. Someone with diabetes, with long standing, with nerves in the legs affected, might take a longer course. So, give me the question again.
Yeah, like the question is more like, once the patient's curative part is over and they know, maybe they don't know they have to take rehabilitation. So how they are, if there are any systems that is having currently from curative to directly to rehab, or should they find the rehab, or what conditions they are specifically should
When a
go for
person
rehab?
can't do things the way they want to, they should seek rehabilitation, because we're going to rehabilitate them back to what they were before as much as possible.
So more like the hemiplegic cases. where-
Hemiplegia, aphasia, cognitive issues, perceptive issues, swallowing issues, mood issues.
Wow, okay. So, and how long would be the, could you just guide me through a rehabilitation process? So for that patient who has a stroke survivor, so he has done, he has come through the worst, I will say. The surgery has been completed. Now he is looking forward a life with disability. So how is the chances for rehabilitation, and how they can, or how the rehabilitation department can help them get better?
So you have to give me one question at a time. It's okay. But first of all, the timeline. The timeline is what everybody wants to know. No one plans to have a stroke. So everyone in the family stops what they're doing to take care of this person with the stroke. And the first concern is, how soon can we get home? So families that have a good support, they can often get this person to stay long enough so they can walk and go home. How long that takes depends on how bad the stroke is and the quality of rehabilitation, and then overall their condition. So people who end up staying a long time in a hospital ward get more and more infections, they get more complications, and it's harder. People who turn around faster do better. That's the first step to it. What was your second question?
Second question was, once they come to rehabilitation. So I'll phrase it once again. So once they come to rehabilitation,
Yeah.
and let us say an example of a hemiplegic patient. So how do the rehabilitation process takes them through to a point of recovery?
So the point of recovery is always based on what the patient expects, and most people want to walk. So we know that after a big stroke, the entire half of the body will go completely flaccid. And in that time, you can't do too much. There are studies that show there's ways to induce that muscle power to come back sooner. But in
Okay.
general, most people take their time. When they get power back, it might not be with that great control, but some stiffness, spasticity.
Hmm.
That usually comes in after 3 weeks.
3 weeks.
Yeah.
Hmm.
So depending again how bad the stroke is, some people get it very early, some people get it later on. It depends on when it comes in. That's how soon they can walk. The next thing is speech.
Yeah.
We know the natural history of disease with stroke. Speech will improve in the first 3 months on its own spontaneously. And then from there, services like speech therapy can help until the first year is over. And once the first year is crossed, they're kind of left with what they have. The next thing is hand. And it's usually going to be the dominant hand that gets affected. So they can't use it for things they used to. In India, that's a big problem. See, in the West, there's toilet paper. In India,
Yeah,
right?
true.
So it becomes an issue for these people. And the hand often comes back last. And when it comes back, if it's a bad stroke, it comes back very tight. So people can't use it. It can become a source of pain. It can be a disturbance for people.
True. So yeah, understanding the point of first the gait, then the speech, then the hand. So normally this takes a 3 week process, and studies say that there's a golden period of rehabilitation, which I read is 3 months. So how important is that 3 months, and how difficult it is to as a doctor if it crosses 3 months or 1 year, 6 months? So
That's a very good question. And it's a limiting factor for those who don't have access to technology. So when the brain gets damaged, there's a part of it that's gone. It's never coming back again. There's an area around the damaged area that now has to take up that function.
okay.
But the main blood vessels supplying them are blocked. Because they're blocked, now it has to get food from someone else. But the neighbors have to work too, so they're not going to give their food to the cells, right?
True.
That's called the penumbra.
Okay.
And that penumbra can keep getting worse. So the acute part of stroke care is to make sure that doesn't spread. But that penumbra, that shadowed area, is essentially a lot of swelling inside the brain reacting to the dead tissue, trying to clear it out. So the question is, how do you get that to go away? And the answer is hyperbaric oxygen therapy.
Okay.
You can grow blood vessels into the brain and make a person heal faster and even longer than if you didn't have access to it. So 3 months is the standard because the majority of people treating stroke are going to be neurologists who don't have access to this technology. When you have access, everything changes. There are studies with high definition investigations that show us even up to 3 years after a stroke, you can regain function.
Correct.
But most of what we see as these guidelines and timeframes are set by doctors who don't have access to these technologies. So they've set this lower limit.
Yeah, appreciate it. So the technology has, speaking about technology, the technology has gone up very much even in the medical field also. So in departments like PM&R, we have HBOTs, we have robotics, we have systems that work well with AI to understand the patient and be adapted to the patient. So speaking about one recent installation, which is a G Gaiter in your institution. So how does that help in this recovery process? I would like to give a better clarity. I would like what happens before G Gaiter or what happens after G Gaiter.
G Gaiter makes everybody's work easier.
Okay.
There's 2 phases where this comes in. One is the subacute phase, where the person has a stroke, they have a deficit, they've come out of the ICU, they just want to walk and go home. But their leg is kind of floppy, and it's not really working that well.
Okay.
So getting their body unweighed, getting them to sit up straight, stand up straight, and then practice walking normally means they can go home sooner. 1. 2.
Yeah.
The second phase is after they've gone home, and now they can't walk properly because they can walk, but their muscles don't work the way they should. These need to be retrained to function the normal way. So what is rehabilitation without robotics? It's hard for everybody. My therapists break their backs trying to move these people and get them to walk. They can only control so many aspects of walking. Mostly they're going to work on controlling the pelvis so the person stands up straight while that person drags their leg along as they walk on the ground and droops to one side. G Gaiter takes care of that. It gets the person erect. It controls the legs for them. They can look into space if they want. They can look and hold the bars if they want. but it makes everything easier so you can retrain normal function. If you retrain normal function, you're training the body the way it's supposed to work, so it's going to be usable longer.
Okay, wonderful. And the therapeutic aspect of gating, now what we talked about is the utility part, where the patient, how they feel, how the therapists feel. But on a very technical part, where we speak about how robotics can, improve or accelerate the speed of rehabilitation or the quality of rehabilitation. Your thoughts, sir?
There's a concept called the motor engram. And the
Okay,
motor engram is a really simple thing. If you do something 10,000 times, it's going to become second nature for you.
correct.
Arun Dominic can walk around, talk on the phone, chew gum, and not step in the cow poop on the ground.
Correct.
Why? Because he's learned how to do all those things. One eye said he knows where it is and how to plan to go over and keep having that important conversation. There's many centers in the brain that control that, but on the spinal cord level, there's a central pattern generator.
Okay,
So when a person has a stroke and the control center from the brain is gone, central pattern generator, the middleman, can still control walking to a good degree, but it needs the right amount of feedback. If a muscle is floppy or if a muscle is spastic, it's getting mixed signals. So it's not really sure how to progress things, so walking becomes slow, awkward, and stiff. But if you're using devices like robots that restore normal walking patterns or mimic it as much as possible, it's balancing things out so central pattern generator can give the right signal at the right time so a person can do more.
okay. So that itself is the key point. That means what I understand here is that the feedback is very much important. And when we train them, when we are training with robotics, we are training them to prepare for real life events.
Perfect practice makes perfect. Not just practice, perfect practice.
Perfect practice.
And perfect is going to be the normal walking pattern. So
Correct.
devices that help us mimic that help us get there.
Yeah. So that perfection can be easily achieved through robotics.
Yeah.
Wonderful. So that is, we are, even as a technologist, I am happy that robotics is going to help at that level.
Yeah.
Wonderful. So coming to we would like to hear some of your experiences where a story where a patient, a similar situation had recovered. This will also help the audience to understand and realize how it is important.
Yeah.
So could you share us a story from
I'm
your
going to give you
experience?
2 stories. One is again for the acute side, one is from the chronic side. So
Wow.
the acute side is always they want to get home and walk, but they're kind of floppy, right? So again, half their body's unloaded, and this helps them move their legs. When they come out of the robot, they can walk sooner, faster, and more appropriately. Meaning when they go home, they don't have to call someone for help as much. If they're calling for help, the other person doesn't do so much work. So it's
Okay.
easier on the entire family. See, what happens is once they get a stroke, if they can communicate, they still feel ashamed having to call someone else to go to the bathroom or get to the dinner table, right? So if they can walk better, they don't need to bother people as much, or they're going to be confident to try getting onto a wall and moving around on their own. That's the acute side.
Understood.
Is once they can walk, they go home, and they don't want to come back. And I don't blame them. The other side is the chronic side. When they've had this for long enough, the spasticity has kicked in, the leg is locking up and it won't move properly, and they're not sure what to do. What happens is mostly people will call a physical therapist to the home. The therapist will pull their leg, get them straightened up, and try to help that improve. Spasticity doesn't always respond to physical therapy. So then you can do medications, you can do injections, you can do braces, but it's not deficiency of those conditions. It's really just an activation pattern. So those who come back in the chronic phase after a stroke with spasticity, if they haven't got the other aspects managed, the bracing, the injections, etc., we can take care of that. But then the next thing is to get them to walk the normal way. And again, the robot helps train that. So the more steps they get in a normal way, the more they can activate their entire body to walk in a helpful or normal pattern.
Yeah. So let us imagine a patient where they are coming in for rehab, like the very early, just after the surgery or something. So how long do they have to stay in a hospital to get it cured?
That is $1 million question. No one knows that answer, but in general, if it's a stroke that is relatively mild, some people will get up and walk within a week.
In a
And
week.
they'll just go home.
Okay.
There's some where they're not so great, or they have other problems confounding things. It might take another 2 to 3 weeks.
So yeah.
If
So
it's If it's the worst strokes that typically leave half the body floppy, they're going to be end up waiting 3 weeks to get something going. Once it gets going, then they can start walking, and then depends on how much they want. So usually we'll give them a cane on the other side, and they can start walking with that and a brace on this leg so it's stiff and not bending on them. The guys who have the worst strokes often spend their first few months in ICU, waiting to come off the ventilator. Then they come to the ward, and they may not even be fully conscious. So there's no straight answer. It's always stroke severity.
Yeah. So, talking about, we have covered the topics of having technology assisting the rehab process, to having things, devices like robotics and the lower limb gait trainers, upper body robotics. So these all fasten the process in many ways, and it's not more like a question of completely bedridden. There's a chance of getting better and leading a good way of life if we go to a proper rehab process. So, understanding that fact, how do you envision the future? Because even we live in India, and there are many rehab centers which are yet to adapt. The specialty care centers also yet to adapt this high level treatment methodologies and programs that can help the people get better in terms of rehabilitation. So, how do you envision a future coming in India?
Once the stroke is addressed, once that clot or bleed is addressed and is no longer a problem, and even before, you really want to get that person to wake up if they're not conscious.
Okay.
If they're conscious, you want to get their body moved.
Body
If they're
moved.
unconscious, you still want to get the body moved so the muscles don't become weak.
Weak.
By the time they're conscious and they can do something, they should be brought into a gym where they can get some more mobilization till they can stand. Human function and human brain functions in an erect position. So if you have a person laying in a bed all day, they're probably going to sleep because that's what we're trained to do. No one sleeps standing up, right? So when they're made to get erect, blood flows to the brain more, the brain picks up and it wants to see where is it, what's going on, right? But that's all just technology. And the thing is, right now, there's no other doctor trained to deal with stroke and its natural history of disease from beginning to end, except for a physiatrist. So there aren't too many of us, and that's our own problem. But for a person who suffered from a stroke to get the complete package from beginning to end, they would have to meet such a doctor. And why? It's not just about procedures, it's not about therapy, it's not about injections or medications. There's always going to be a point at which there's no more return. We've done all of this. A person still isn't as good as they want to be, but they don't know what to do. And what we find over and over again is then people go to quacks, they look for the latest technology, they look for the next sham, hot jade stones on their back to make things magically improve. There's no problem for those things, but it's a waste of money. If it makes them happy, that's okay, but there's no science behind that. And at some point we had to say, okay, this is what you have, let's work with it. And why? Because what we find over and over again is through any amount of therapy, there's a limit you're going to accomplish. But when a person has a reason to improve, they show you just how good they are. And we have people who go to the best places, get the most technology, get everything, but they have no motivation. So they do all these wonderful things, go home and sleep. Right? But if they have a reason, if they want to go to the next wedding, they want to go to midnight mass at the church, they want to go and see their friends and play cards, there's a reason to do something, and now they have to get better because there's a reason. So after rehabilitation becomes adaptation, because they're going to go on living.
Yeah, true.
And this is what we do.
Okay. So, and one more question that comes to my mind, in fact, the patients, how much awareness is there on the side of the patients? Like, you have been taking in patients and meeting patients day in and day out. So when you explain the rehabilitation process to them, like how supportive they are, or do they feel like they are kind of unaware of these situations? How do you feel? How do patients feel to the rehab?
You give me two questions at a time, so it's okay. But it's two different things. So what is the response we get from patients? We live in very fast times, and people are used to coming in, getting something, and going. So rehabilitation is a very slow process. It's often going to be patient-led, where the patient says, I have this problem and I need to overcome it. What do I do? And it's not where the doctor dictates the term and the person does. The patient actually helps guide us and say, I've done all these things. I don't know what more to do. Right? That's when we can say, these are your options. What would you like to do? What was the second question?
A second question is like how the patients feel about like it's not a commonly aware thing.
So most people don't like it. And why? Because it's going to be time invested, staying away from home, and that sort of a thing. So it's natural that they would feel that way. There's nothing wrong in it. It's just the question is, how do we get people to be their best self when they have all these natural constraints? Because if it's a person who's had a stroke, it's often going to be a man over the age of 50. That's going to be the father in a family. He's the primary breadwinner. Right? If he's not making money, who's taking care of the kids? Who's getting those kids to school? Who's motivating them to finish their exams and scolding them and keeping them out of trouble? And then who's taking care of them? The mom. So where's the time for the rest of the family?
Yeah.
This is the reality we face. But again, the higher quality rehabilitation they get in the time frame that it's available, the better they can do with what they have.
Yeah. And coming to this point, we talked about how robotics can fasten the time frame, or rather than having a higher intensive rehab. So, with your personal experience with a robotic device, G Gaiter, the robotic gait trainer, how do the patients have the feel? How once they, because mostly I feel they will be hesitant seeing a big device and all.
Yeah.
So once they are into the device and once they are through the process, what is the difference?
We haven't had a problem yet.
Okay.
We haven't had a problem yet. Most people are fascinated. They sit back and watch what's going on. What
They're
they're doing
curious
that
to
person.
try.
Yeah, but then the other person is really interested. They're going through it. There's virtual reality. There's a screen showing a walk on a beach. Well, it's kind of fun.
The games and all those things.
Yeah.
So in general, the intention to the patient's perception towards robotics is positive, I can say.
We haven't had a problem. Maybe 15 years ago when I joined, people would not know what this is, or they'll mistrust the intentions. But I think more people are seeing enough technology where they know that it's going to be good for them. And if not, they can watch someone else get better.
True. Because even now we live in an era of chat GPT, so
exactly.
robotics is not an issue. Wonderful. So coming to another part of this conversation, sir. So we are talking about the rehabilitation, we are talking about the curative, how to prevent this, how to be live maybe from a physiatrist perspective, how can we prevent an episode of stroke?
Prevention of stroke comes back to the basics of medicine. And it's just the 6 pillars of lifestyle medicine. So get restorative sleep. When you go to sleep, sleep deep, wake up fresh. And that is really sleep architecture and sleep hygiene. So sleep in a quiet place, in a temperature that's controlled, where you're comfortable. Don't have screens on your face before you sleep. Don't have loud noises. Don't have a lot of stimulation. Don't drink too much water before bed. All those small things provide good quality of sleep. And if not, there are medications that can help, but they're not substitutes. 1. 2, diet. Whole food, plant-based diet. It's very unpopular. I'm also shifting into it. It's very hard. No salt in food is tricky. But all these things, salt leads to high blood pressure. High blood pressure leads to damaged blood vessels, be it in the heart or in the brain. And we know what happens from there. Good company. Not company we like because they could be doing nonsense, but good company. People that have good habits. Daily physical exercise and activity. Our bodies are meant for that. We have very sedentary lives nowadays. Prevention of stroke is more important than treating it, because if you prevent that, you can do much more for people.
Correct. Wonderful, sir. So to sum up with one last question. So like we are having obviously preventive care is the right thing to do. And once if we get into such a situation, there is good quality curative part we have. Now the rehab is coming up fast and well enough. Physiatrists are, I'll say numbers are growing. And so in the future of a rehab, what all technologies, on a technological point of view, what all technologies will help or make rehab a better experience from your perspective, sir?
A lot of my colleagues are focused on organs or conditions. As physiatrists, we focus on people.
People.
So what's going to make it better will make things better for people. So we recently ran an AI hackathon with just a bunch of physiatrists, AI specialists, and mechanical engineers. And what we tried to do is figure out what are the problems these people face and how can we help them. And it came down to actually 14 different domains. Aside from the motor issues of hand and leg, there were speech domains. A lot of people who've had a stroke, they can't go back to life as it was. So they don't know what to do. So they withdraw themselves from society. They can't be the father in a family where they can't scold the son who's misbehaving because they can't speak. When they make gestures, no one knows what it is, so they just laugh at him. So they withdraw. And when they withdraw enough, they become depressed. When they become depressed, they develop dementia. If that gets bad enough, they completely lose track of their entire body and lay there doing nothing. So the key here is that we start addressing what needs people have. One of the engineering groups I work with has actually found a way to use the eyes and eye movement to generate speech.
Oh, wonderful.
And that way a person who can't talk or can't get their words out but wants to can at least do this much. So once they can say, hey, I need to go to the bathroom, I'm angry at you, I love you, hey, thanks. It's small things. It's the small things that make that connection between people. It's not really big fancy words, right? You tell a joke, someone laughs, right? That's reciprocation. Then your life has more meaning. Rather than sitting there waiting for someone to come give you food, right? So it always comes back to what the patients need and how we can get there. Artificial intelligence is definitely one of those ways because there's cognitive issues, there's social issues, there's mood issues, there's actual need to just go out and have a good time. Go to the latest movie.
Yeah.
Right? And you can talk with everyone else or laugh when they're laughing about the joke that some guy did in a movie, right? That's how we get that sense of belonging, self-esteem, and meet our own self-actualization.
So focusing back on their own self and having a purpose. That again reflects with our motto of this World Stroke Day is greater than stroke.
Yeah.
So thank you for your time and sharing the knowledge with us. So in an effect, we understand from this episode is that prevention is always the best. Once it happens, there is good curative part, and there is a very important rehabilitation part, which lets you back to your life and possibly bring back normal days to you. So on this World Stroke Day, let us all focus towards how we can be greater than stroke. Thank you.